Hi, this is Vira, and I'm a clinical application coordinator for Phoenix area. And in this presentation, we're going to go over reminder definition. Our learning objectives would be to discuss application and use of clinical reminders. We're going to describe thought process behind creating a clinical reminder, and we're going to examine the local application for creating site-specific clinical reminders. What interventions are due? It's going to be based on national guidelines and standards of care and immunization guidelines. Sites decide which reminders to implement based on their needs. What does one look like? So let's take a look at the PAP test 21 to 29 years old. So let's take a look in the RPMS for that PAP test 21 to 29-year-old. So sign into RPMS and then go into the reminder menu and select RI, which is Inquire About Reminder Definition. Here we know all the national reminders will start with IHS, so we're going to start it with IHS-PAP. The one we want to evaluate is number 5. And then if we put semicolon, semicolon, 999999, we're not going to have to hit the enter key. It will all be splashed on the screen. Okay, if we go up, we can evaluate this reminder. You will have the dialog that's attached to reminder. You will also have the print name. This is useful for when you're looking for the reminder in the GUI side. This is the reminder's name, which will show up in RPMS side. This is what you're going to use to bring it up on the RPMS reminder menu. And it also gives you detail in what the reminder is looking for. And you will also get the standard that the reminder used. In this reminder, we see that it's due every 3 years for ages 21 to 29. There are some reminder terms. It has some taxonomies. There's a computer finding. And then down here is where you're going to find the logic. You got the cohort logic and you got the resolution logic. We will explain this in more detail later on in the course. Before you create a reminder, we need to ask certain questions. Who needs the reminder? That's going to be your cohort logic. That's what turns it on. It's going to be sex and age. It's always sex and age. But then is a disease is what we're looking for to turn our reminder off, and is that disease to be included or exclusion? The next thing that we need to think about is how frequently does this reminder needs to be due? Is it once a year, only once in a lifetime, or every 6 months, every 3 months? The other question we need to ask is what's going to resolve this reminder? Is it a lab test, a procedure test, a measurement, a medication, a computer finding? And the resolution for our reminder has to be something that is structured data. The dialog. Are we going to create a dialog to help satisfy this reminder? So where this site would like to be resolved? Is it going to be by the location or by a provider? It's going to help determine if and what type of dialogues you need. How do you want users to resolve this reminder? So it's going to be with information today's visit or information historical visits. That's going to help you determine what type of dialogue you're going to create. So here is the anatomy of a reminder. So the first field is due in advance is when do you want your reminder to turn red? And it's usually early. So do you want it to turn red 3 months before it is due? And then age specific. Do you only want this reminder to be applicable to female or to male or to both sex? If it's going to be both sex, you just leave that field blank and it will be for either female or male. So then you're going to look at the reminder frequency. So the first one, advanced time frame, that's usually for how early do you want it to turn red. The reminder frequency is how frequently this reminder is due. And then you have the minimal age and maximal age. If you leave it blank, it's going to apply to old age. You want to leave the text of age max empty, and you want to leave the next text prompt, age not max. So these are the parts of the reminder. You got specific pieces of data, which are individual findings. They could be lab, medication, exam. Then you have group of data, which are taxonomies, which is a group of diagnosis codes and procedures. Terms are a group of education topics, of health factors, lab value, medication, etc. And then you have some computer findings that can be created for your reminder. So here are the types of findings that's really available for us to choose from. We can choose from a drug class, VA drug class, or generic drug class, or the actual drug. You want to use the VA drug class and the VA generic class, either one, when possible. The only time you want to use drug when there's no generic or drug class for that particular medication. The education topic, they're usually grouped in reminder terms. The exams and health factors are also all grouped within reminder terms. We can use measurement type, and this is looking at the IHS measurement. You do not want to use the vital measurement. These are not the vital signs that are used by IHS. This vital measurement is looking at a different file that we do not use. Refuser type is not recommended to be used as a reminder logic. Immunizations, you group them in the reminder terms. You can also select from skin test, portable item, laboratory test, which usually are grouped within reminder terms, and radiology procedures. Then you have findings that are looking at taxonomies, either ICD-9, ICD-10, CPT, procedure codes, ICD-0s, HIPPICs, etc. And you may want to use some old codes, ICD-9s, especially when you have reminders that are looking for past diagnoses that occur before we implement ICD-10. Then you got reminder terms. These are a group of findings, and you can have specific conditions associated with these findings. You got computer findings, and these are routines that are right to extract data that is not otherwise available. Other examples of computer findings that you will find in our system are the ones that use the immunization that was going to look to see if the vaccine is due or not. Another computer finding that we have is the PAP computer finding that's going to go and look at the health maintenance reminder logic to find that PAP. What it means to us is that we got to make sure that the taxonomies within the health maintenance reminder contains all the correct labs for our PAP. And then we also have another computer finding for allergies. It's going to look for any allergies to a specific drug, or in this case, asthma. Then we have the asthma control finding, which is going to pull information from the IPL with anybody that has the diagnosis of asthma, and it's going to look to see if it's been documented, if it's well controlled, not well controlled, or poorly controlled. Then we have the reminder location. This is a new enhancement to 2.0. We now can create customized findings, or we can also create cohort logic that's going to look for in a specific hospital location or clinic. And you have to set up that clinic or hospital location under the reminder location list management option. And once you create that, you can pull that over and use it in your reminder. Cohort logic are findings that can be used in logic to determine who is the reminder applicable. It includes patients with a measurement over set value, or it could include a diabetes diagnosis. You can also exclude patients. For example, patients with colon cancer, hysterectomy, allergic to eggs, or measurement over a set value. You can even exclude clinic stop codes or hospital locations. Findings can be in the logic to determine who, like for diabetes, you have patients with diabetes, and you're going to use a computer finding in order to find those codes for diabetes. With a colon cancer, and then a history of hysterectomy, it uses another taxonomy. With allergies to eggs, can use another, it's a computer finding. And with the measurement over set level, using a term with a condition. Here are some examples of resolution logic. You got common finding groups to determine what is going to resolve our reminder. It could be a computer finding. For example, here we have HIV, which is looking at the health maintenance reminder logic in order to resolve our reminder. It could be a set of codes, like this Like here, we have the IHS-Depot Administration. It's a set of CPT codes to help us determine if a depot administration was done. Then you have the reminder terms, which could be, for example, ACE-ARB, it's going to be medications, or the diabetes codes, because now that we have ICD-10 and we use SNOMED, you have to have a computer finding that's going to look the SNOMED term of the particular ICD-10 code that you want to use to resolve your reminder. And you have lipid tests. Those are local lab terms. Another common finding would be measurement. For example, the weight one that you see below here. Taxonomy is used to define the who, which is our cohort logic. Who is this applied to? And it can also be used for the resolution logic, for what's going to resolve this reminder. You can enter low and high numbers. There's a range that you can include. Several ranges can be used in the same taxonomy. If a computer finds any item in the list, the finding is true. Taxonomies. If the problem is chronic, subacute, or social environmental, it's going to use today to see if it's in the date range. A word about reminder taxonomies. These contain ICD, diagnosis, procedure, and CPT procedure codes. These do not contain SNOMED terms. The developers developed a computer finding that will be used to call a SNOMED subset to capture the SNOMED term. Subsets are maintained at the Central Terminology Service server. Requests for a SNOMED subset for reminders should be sent through the RPMS feedback. You will select the application SNOMED DTS. So let me demonstrate that. So when you want to request a new subset for your reminder, you need to go into the IHS, then select R, then go into RPMS, and select the feedback. Once you're at the feedback page, you're going to go ahead and fill all the information requested, and then select application, and within the application, you're going to look for SNOMED, and you're going to select that, and then in the comment is what you're going to add what you need. Here's an example of a taxonomy. So we're going to look at the asthma 2013. You got to make sure that you put the patient source, the ENPL. So here we're looking at the ICD-9 codes. So here's an example of how it's going to look. And then this is more example of that taxonomy. Reminder terms allow you to make groups of other findings. Example are lab tests, drug, education topic, health factors, vital signs. It can contain more than one type of finding. You can put a measurement and an exam, a taxonomy, or even a computer finding. So you can put a lot of different types of findings within a term. If the computer finds one, the result is it's true, and then it quits. You can use conditions in a reminder term, such as systolic blood pressure greater than 139, or you can also use for a lab for A1Cs greater than 7. So you can build in conditions within your terms. Here's an example of a term, and we're looking at the immunization for hepatitis A. And then here's an example one with a condition. We're looking at a blood pressure. And then right here, it just tells you any systolic or greater than 139 or diastolic greater than 89 is going to be true. For more information about conditions and the type of condition that can be used for the different findings, this is found in the manager's manual for the clinical reminders, and you have a copy of this within your packet. Computer findings. It's going to allow a programmer to write a routine to get data out of RPMS file and use it in the reminder. It's used to get data from the immunization forecaster files. It's going to be used to retrieve findings from PCC help maintenance and best practice prompt. It's used to retrieve allergy data, and also it is used for SNOMED lookup. In this example, we're looking for allergies of a drug, ACE-ARB. And there's a routine and an entry point to that routine. There is a need to look for both ICD and SNOMED-CT in problem and POV lookup. To meet the need to look in both the ICD and the SNOMEDCT, you use a reminder term. So in that reminder term, you're going to put the reminder taxonomy, and then you're going to put the IHS SNOMED computer finding. Here's an example of the term. So as you can see, we put the taxonomy for diabetes, but within the parameter, computer finding parameter, we put in the PXRM diabetes subset. And these are the subsets that you're going to request if you do not see one in there that you can use. So this concludes our presentation on reminder definition. If you have any questions, please contact your area CAC for further information or your local CAC. And I hope this was helpful, and thank you for watching. Bye now.